The yellow taxi pulled away from the curb as Isabella Martinez clutched her swollen belly, tears streaming down her face. What had just happened in those 23 minutes would change not just her life, but the life of a man who thought his best days were behind him. The driver, 62-year-old Samuel Anderson, had no idea that his simple act of kindness was about to create ripples that would reach the very foundations of the city's most prestigious medical institution. 3 days earlier, Samuel had been staring at the eviction notice taped to his apartment door. 27 years of driving taxi through the streets of Chicago, and he was 3 months behind on rent. His wife Lynn had passed away 8 months ago, taking with her not just his heart, but the supplemental income from her job at the corner market. The medical bills from her cancer treatment had drained every penny of their savings, and now Samuel was barely making enough to cover his daily expenses, let alone catch up on the mounting debts that seemed to multiply like weeds after a storm. He folded the notice carefully and slipped it into his jacket pocket, right next to the worn photograph of Lynn on their wedding day. "One day at a time, old man," he whispered to himself, using the same words Lynn had said during her final weeks in the hospital. The taxi company had been understanding about his situation, but understanding didn't pay the bills. At 62, starting over seemed impossible. Yet Samuel climbed into his cab each morning with the same quiet determination that had carried him through 4 decades in America after immigrating from Taiwan, with nothing but hope and a willingness to work. The dispatcher's voice crackled through the radio that Tuesday morning. "Samuel, got a pickup at Northwestern Memorial, maternity ward. Pregnant woman needs transport." He pulled up to the hospital's main entrance, watching as a young woman emerged from the automatic doors. Isabella Martinez was 34 weeks pregnant with her first child, her husband deployed overseas with the military. She had just finished what she hoped would be her final emergency visit for complications with her pregnancy. The doctors had assured her everything was stable, but living alone and managing these sudden health scares was taking its toll on her already strained finances. "Where to?" Samuel asked gently, noticing the exhaustion in her eyes as she settled carefully into the back seat. "Pilsen neighborhood, please. The address is 1847 West Cullerton." Samuel knew the area well, a vibrant Latino community about 15 minutes from the hospital. As they drove, Isabella found herself opening up to this quiet, kind-eyed driver. She explained about her husband Miguel's deployment, how she was managing on her military family allowance while working part-time at a local community center, and how these unexpected medical visits were eating into the small emergency fund they had managed to save for the baby's arrival. Samuel listened without judgment, recognizing in her voice the same brave determination Lynn had shown during her illness. When they arrived at Isabella's modest apartment building, she reached into her purse and pulled out her wallet. The fare was $47.50 with tip. As she counted out the bills, Samuel noticed her hands shaking slightly and saw that she was left with only a $20 bill and some loose change. It was clearly all the money she had until her next paycheck. "No charge today," Samuel said firmly, turning around in his seat to look at her directly. "You take care of that baby." Isabella stared at him in shock. "Sir, I can pay. I have the money right here." But Samuel was already getting out of the car to help her to the sidewalk. "My wife and I, we never had children. We always said someday." His voice grew soft with memory. "You remind me of her when she was young, before she got sick. That baby is a blessing. You keep your money." Isabella began to cry, overwhelmed by this stranger's unexpected kindness. She tried to press the money into Samuel's hands, but he gently refused, helping her safely to her apartment building's entrance. "What's your name?" she asked through her tears. "Samuel Anderson," he replied. "And you remember, Mrs. Martinez, that there are still good people in this world. Your baby is going to be born into a world with good people." As he drove away, Samuel felt a lightness in his chest that he hadn't experienced since Lynn's passing. For just a moment, he had been able to give instead of just struggling to survive. That evening, Isabella sat staring at the business card Samuel had given her with his taxi company's information. She thought about her husband Miguel, somewhere in Afghanistan, worried sick about her and their unborn child. She thought about Samuel's gentle eyes and the way he had refused her money without making her feel like charity. Something about his kindness felt different, pure in a way that demanded recognition. She pulled out her laptop and began typing an email to her husband, but then stopped. An idea was forming, one that would require her to reach out far beyond her usual circle. Isabella's husband, Miguel Martinez, wasn't just any soldier. Before his enlistment, he had been a brilliant medical student at Johns Hopkins, one of the top 5 in his class, before financial pressures forced him to leave school and join the military to support his family. His commanding officer, Lieutenant Colonel James Morrison, had been trying for months to convince Miguel to apply for the military's advanced medical training program once his deployment ended. Miguel had the intellect and dedication to become an exceptional military surgeon, but he had repeatedly declined, claiming his priority was getting back to civilian life to provide for his growing family. Isabella knew, but rarely shared, was that Miguel's former medical school roommate was now Dr. David Park, a prominent cardiothoracic surgeon at Presbyterian St. Joseph Medical Center, one of Chicago's most elite private hospitals. David had been offering Miguel a position in his research team for years, but Miguel's pride and circumstances had prevented him from accepting what he saw as charity from his more successful friend. David Park wasn't just any doctor, however. He was the son of Korean immigrants who had built a small grocery store empire across Chicago's South Side, and he understood intimately the struggles of immigrant families trying to make their way in America. Isabella had met David only once, at her wedding, but she remembered his kindness and his genuine respect for Miguel's abilities. Now, sitting in her apartment with Samuel's business card in her hand, she made a decision that would set in motion events none of them could have imagined. She found David's contact information and composed a careful email, explaining not just about Samuel's kindness, but about what she had observed in his character during that brief taxi ride. She described his dignity, his gentleness with her pregnancy, and the way he had given, without expecting recognition or reward. David Park read Isabella's email while sitting in his office overlooking Michigan Avenue, 40 floors above the bustling city. He had just finished a 16-hour surgery on a prominent businessman's heart, another wealthy patient whose family would donate generously to the hospital foundation. David was successful by every measure, but lately he had been feeling disconnected from the reasons he had originally chosen medicine. His parents had sacrificed everything to give him opportunities they never had, and he often wondered if he was truly honoring their legacy, or simply accumulating wealth and status. Isabella's description of Samuel Anderson resonated deeply with David. His own grandfather had driven taxi in Seoul before the family immigrated, working brutal hours to save money for his children's education. David had never forgotten the stories his father talked about those early years, about the kindness of strangers who helped when everything seemed hopeless. As he read about Samuel's refusal to accept payment from a pregnant woman, despite his own obvious financial struggles, David felt something stir in his chest that he hadn't experienced in years. But David Park wasn't just any successful doctor making good money. He was also the chairman of the hospital's charitable foundation, a position that gave him considerable influence over the institution's community outreach programs. More importantly, his hospital had been struggling with public relations issues lately, criticized in local media for being disconnected from the working-class communities that surrounded their gleaming medical complex. The hospital's board had been pressuring David to develop programs that would improve their community image while actually making a meaningful difference in people's lives. As David read Isabella's email a second time, an idea began to form. He had been looking for authentic ways to connect his hospital with the immigrant communities that made up so much of Chicago's workforce. Samuel Anderson represented exactly the kind of person they should be supporting. Someone who embodied the values of service and sacrifice that the medical profession was supposed to represent. David picked up his phone and called Isabella Martinez. "Mrs. Martinez, this is Dr. David Park. I received your email about the taxi driver who helped you." Isabella was surprised to hear from him so quickly. "Dr. Park, thank you for reading it. I just felt like someone should know about his kindness." David's voice was warm and thoughtful. "Tell me everything you can remember about your conversation with Mr. Anderson. I'm particularly interested in his background and his current circumstances." For the next 20 minutes, Isabella shared everything she could remember about Samuel's story. His immigration from Taiwan, his 27 years driving taxi, his wife's recent death from cancer, and the medical bills that had left him in financial ruin. She described his dignity in the face of hardship and the way he had spoken about his wife with such love and respect. David listened carefully, taking notes, his mind working through the possibilities. "Mrs. Martinez, would you be willing to help me contact Mr. Anderson? I'd like to meet him, but I want to approach this in a way that respects his dignity." Isabella agreed immediately, sensing that David's intentions were genuine. They arranged for Isabella to contact Samuel about needing another ride to the hospital for a follow-up appointment, but this time, the destination would be different. Samuel was surprised, but pleased to hear from Isabella Martinez again. She had called 3 days after their initial encounter, asking if he could pick her up for another medical appointment. "Of course, Mrs. Martinez. How are you and the baby doing?" Her voice sounded stronger, more hopeful than before. "We're doing well, Mr. Anderson. The appointment is at Presbyterian St. Joseph Medical Center this time. My doctor wants me to see a specialist there." Samuel knew the hospital, an imposing glass and steel structure in one of Chicago's most affluent neighborhoods. It was the kind of place where wealthy patients received world-class care, and taxi drivers like him usually only entered to drop off passengers at the main entrance. As he drove Isabella through the city's changing neighborhoods, from her working-class area to the gleaming medical district, Samuel found himself thinking about the contrasts that defined urban life, the invisible barriers that separated people by circumstance rather than character. When they arrived at Presbyterian St. Joseph Medical Center, Isabella asked Samuel to wait for her. "The appointment shouldn't take long, and I'd prefer to ride back with you if that's okay." Samuel nodded, parking in the visitor area and settling in to wait. 15 minutes later, Isabella emerged from the building. But she wasn't alone. Walking beside her was a tall, well-dressed Asian man in an expensive suit, someone who clearly belonged in this environment of wealth and privilege. "Mr. Anderson," Isabella said, as they approached the taxi, "I'd like you to meet Dr. David Park. He's the friend I mentioned, Miguel's former roommate from medical school." Samuel got out of the car, extending his hand politely, but feeling somewhat confused about why Isabella had arranged this introduction. David Park shook his hand firmly, looking directly into Samuel's eyes with genuine warmth and interest. "Mr. Anderson, Mrs. Martinez has told me about your kindness to her the other day. I was hoping we could talk for a few minutes, if you have time." Samuel glanced at Isabella, who nodded encouragingly. "Of course, doctor, though I'm not sure what there is to discuss." David smiled, and Samuel noticed that his expression held none of the condescension that he had sometimes experienced from wealthy professionals. "Actually, there's quite a lot to discuss. Would you mind coming inside? There's something I'd like to show you and a proposition I'd like to make." Samuel hesitated, feeling out of place in this environment. But Isabella took his arm gently. "Mr. Anderson, please. Dr. Park is someone you can trust. Miguel always spoke so highly of him, and I think you'll be surprised by what he has to say." The three of them walked through the hospital's gleaming lobby, past expensive artwork and marble floors that reflected the afternoon sunlight streaming through floor-to-ceiling windows. Samuel had never been inside a hospital like this one, where everything seemed designed to project wealth and exclusivity. David led them to a conference room on the executive floor, offering Samuel coffee and ensuring he was comfortable before beginning what would prove to be the most important conversation of Samuel's life. "Mr. Anderson, I want to start by telling you about my family's story," David began, settling into a chair across from Samuel rather than behind the imposing conference table. "My parents immigrated to this country from South Korea in 1978. My father drove taxi for 3 years while learning English and saving money to open a small grocery store. I grew up watching him work 16-hour days, watching him serve customers who sometimes treated him poorly because of his accent or his background." Samuel listened intently, recognizing familiar themes in David's family history. "Your parents sound like good people, doctor. It takes courage to start over in a new country." David nodded, his expression growing more serious. "They were, and they taught me that success isn't just about what you achieve, but about how you use your achievements to help others who are facing the same struggles they once faced. David leaned forward, his voice taking on a more direct tone. Mrs. Martinez told me about your situation, Mr. Anderson, about your wife's illness and the financial hardship you're facing. But more importantly, she told me about your character, about how you refused payment from a pregnant woman even when you clearly needed the money yourself. That kind of integrity is rare, and it's exactly what this hospital needs more of. Samuel felt uncomfortable with the praise, shifting slightly in his chair. Doctor, I appreciate your kind words, but I don't need charity. I've been taking care of myself for 62 years, and I'll find a way through this situation. David held up his hand gently. Mr. Anderson, what I'm about to propose isn't charity. It's a business proposition, one that would benefit both you and this hospital. David stood and walked to the window overlooking the city. This hospital has been criticized lately for being disconnected from the communities we're supposed to serve. We have world-class medical facilities, but we've lost touch with the people who make this city work every day. People like you, Mr. Anderson. People who understand service, who understand sacrifice, who understand what it means to care for others without expecting recognition. Samuel remained quiet, uncertain where this conversation was heading. David continued, I want to offer you a position here at the hospital, not as charity, but because we need someone with your experience and character to help us reconnect with the community. You'd be our community outreach coordinator, working with immigrant families, helping them navigate our medical system, ensuring they receive the care they need, regardless of their ability to pay. The proposal hit Samuel like a physical blow. After 27 years of driving taxi, the idea of working in a professional environment, of having a steady salary and benefits, seemed almost too good to be true. Doctor, I appreciate the offer, but I don't have any medical training. I don't have a college degree. I'm just a taxi driver who speaks a few languages and knows how to treat people with respect. David returned to his seat, his expression growing more intense. Mr. Anderson, do you know what the biggest problem we face in treating immigrant patients isn't? It's not lack of medical knowledge or advanced technology. It's trust. It's helping people feel comfortable enough to seek care when they need it, to understand their treatment options, to know that they'll be treated with dignity regardless of their background or financial situation. You already possess the most important qualifications for this position. Isabella had been listening quietly, but now she spoke up. Mr. Anderson, think about how you made me feel in your taxi. You saw me as a person, not just as a fare. You treated me with kindness when I was scared and alone. That's exactly what Dr. Park is talking about. That's exactly what patients in this hospital need. David nodded enthusiastically. Exactly. And the position comes with a full benefits package, including health insurance, retirement contributions, and a salary of $75,000 per year. More importantly, you'd be helping people every single day, people who are facing the same kinds of challenges you've faced, people who need someone who understands their struggles. Samuel sat in stunned silence, processing the magnitude of what was being offered. $75,000 was more than he had ever made in a single year, more than enough to solve his immediate financial problems and provide security for his remaining years. But beyond the money, the idea of using his experiences to help others, of finding purpose and meaning after Lynn's death, was almost overwhelming. There's one more thing, David added, his voice growing softer. Part of your role would involve working with our patient financial assistance program. We want to establish a fund specifically for immigrant families facing medical crises, families who fall through the cracks of traditional insurance coverage. The fund would be named in honor of your wife, the Lynn Anderson Memorial Fund for Immigrant Family Medical Support. At the mention of Lynn's name, Samuel felt tears beginning to form in his eyes. The idea that his wife's memory could be honored through helping others, that her struggle with cancer could somehow be transformed into hope for other families, was more than he had dared to imagine possible. David continued, the hospital board has already approved the position and the initial funding for the memorial fund. We've been looking for the right person for months. someone who embodies the values we want to represent. Mrs. Martinez's email about your kindness to her was the confirmation we needed that we had found that person. Samuel looked at Isabella, who was smiling through her own tears. You planned this, he said, not accusingly, but with wonder. You and Dr. Park, you planned this whole meeting. Isabella nodded. Mr. Anderson, after what you did for me, I couldn't just let it go. I had to find a way to pay it forward, to make sure someone like you got the recognition and opportunities you deserve. David leaned back in his chair, giving Samuel time to process everything. Mr. Anderson, I need an answer soon, because we'd like you to start next Monday. But I want you to understand that this isn't just about helping you. This hospital needs what you have to offer. We need your experience, your compassion, your understanding of what it means to serve others. We need someone who can help us remember why we went into medicine in the first place. Samuel stood slowly, walking to the window that overlooked the city where he had spent 27 years driving taxi, learning every street and neighborhood, serving people from every walk of life. Below, he could see the endless stream of cars and pedestrians, each person carrying their own struggles and hopes, their own stories of survival and perseverance. Doctor, he said finally, his voice steady despite the emotion in his chest. I accept your offer, but I have one condition. David and Isabella exchanged glances, both hoping Samuel's condition wouldn't complicate the arrangement they had worked so hard to create. Samuel turned from the window to face them both. I want to continue driving taxi 2 evenings a week. Not because I need the money, but because that's where I learned everything. I know about serving people, about understanding their needs, about seeing the humanity in everyone, regardless of their circumstances. If I'm going to help immigrant families navigate this hospital system, I need to stay connected to their world, to remember what it feels like to worry about paying for gas to get to work the next day. David smiled broadly. Mr. Anderson, that's not a condition. That's exactly why you're perfect for this job. Of course you can continue driving taxi. In fact, I think that connection to the community will make you even more effective in this role. Over the following weeks, as Samuel transitioned into his new position at Presbyterian St. Joseph Medical Center, word of his story began to spread throughout the hospital. Nurses and doctors who had become cynical about their work found themselves inspired by his genuine care for patients, his ability to communicate with families in multiple languages, and his talent for helping people navigate complex medical and financial systems. The Lynn Anderson Memorial Fund grew rapidly, not just through the hospital's initial investment, but through donations from staff members who were moved by Samuel's story and Lynn's memory. Within 3 months, the fund had helped more than 50 immigrant families receive essential medical care that they otherwise couldn't have afforded. Isabella Martinez gave birth to a healthy son 3 weeks later, with Samuel present in the waiting room as an honorary grandfather. Miguel Martinez returned from his deployment 2 months after that, accepting Dr. Park's offer to join the hospital's research team while completing his medical degree through the military's advanced training program. But perhaps the most significant change was in Dr. David Park himself. Working with Samuel reminded him daily of why he had chosen medicine, of the values his parents had instilled in him, and of the responsibility that came with his success and privilege. He established additional community outreach programs, partnered with immigrant advocacy organizations, and transformed Presbyterian St. Joseph Medical Center into a model for how elite medical institutions could serve their entire community. On the first anniversary of Lynn Anderson's death, Samuel stood before a gathering of hospital staff, community leaders, and immigrant families who had been helped by the Memorial Fund. In his quiet, dignified way, he spoke about his wife's courage during her illness, about the kindness of strangers who had helped them during their darkest moments, and about the importance of seeing opportunity for service in every interaction. My wife Lynn used to say that we are all connected, that kindness creates ripples that travel far beyond what we can see, Samuel said, his voice carrying clearly through the hospital's main atrium. When I refused payment from Mrs. Martinez that day, I was thinking only about helping one pregnant woman. I had no idea that this simple act would lead to so many changes, would help so many families, would give my wife's memory such beautiful purpose? He paused, looking out at the faces gathered before him, faces representing dozens of nationalities and backgrounds, all united by their commitment to caring for others. The lesson I want to share is this: we never know when our actions will create something larger than ourselves. Every day, we have opportunities to choose kindness, to see the humanity in the people we encounter, to remember that we all struggle and we all need help sometimes. The taxi that had brought Samuel to that fateful encounter with Isabella Martinez was now permanently retired, replaced by a steady position that provided security and purpose. But the lessons learned during those 27 years on Chicago's streets, the understanding of human nature developed through thousands of conversations with passengers from every corner of the world, continued to inform Samuel's work every single day. As he helped immigrant families navigate the complex world of American healthcare, Samuel drew on his own experience of struggle and survival. His understanding of the dignity that every person deserved, regardless of their circumstances. The scared pregnant woman, the elderly man confused by medical bills, the young father working 3 jobs to pay for his child's treatment. Samuel saw himself and Lynn in every face, and he treated each person with the same kindness he would have wanted them to receive. Dr. David Park often reflected on how a single email from Isabella Martinez had transformed not just Samuel's life, but the entire culture of their hospital. The community outreach program Samuel had developed became models for other medical institutions across the country. The Lynn Anderson Memorial Fund grew into a multi-million-dollar foundation, supporting immigrant healthcare access nationwide. But more than the programs and the money, Samuel's presence in the hospital served as a daily reminder of the values that should drive medical care. His quiet dignity, his genuine compassion, and his understanding that healing involved more than just treating symptoms inspired everyone who worked with him. Years later, when Samuel finally retired from his position as community outreach coordinator, the hospital established the Samuel Anderson Award for Compassionate Service, given annually to healthcare workers who embodied his commitment to treating every patient with dignity and respect, regardless their background or ability to pay. The taxi driver who once worried about making rent had become a cornerstone of one of Chicago's most prestigious medical institutions, not through wealth or advanced degrees, but through the simple practice of treating every person he encountered with kindness and respect. His story became a reminder that extraordinary impact often flows from ordinary acts of decency, that the most important qualifications for serving others are character and compassion, and that we never know when our simple choices will create ripples that transform lives far beyond our imagination. In a world that often seems divided by differences of culture, language, and economic status, Samuel Anderson's journey from struggling taxi driver to honored healthcare advocate proved that our common humanity transcends all barriers, and that kindness, once offered freely, has the power to create changes that echo through generations. Have you ever had someone show you unexpected kindness during a difficult time? Share your story in the comments below. And remember to subscribe for more inspiring stories about ordinary people creating extraordinary change through simple acts of compassion.